Good evening. Good evening, everybody, and welcome to another episode of Fertility Talk. And tonight we are talking to MNI, to Sanjay from MNI. I'm just going to wait for a few people to go on live to join us. So, yeah, hope you're all doing well. And we'll just wait for a few of you to join us. There we go. Good evening. Thank you for joining. So there we go. MNI is live. And Sanjay, I'm just going to wait for one or two people to join us. I think, I'm so sure I'm pronouncing your name wrong. And there we go. Let me just add you. Sonia. Here we go. Should get it now. Go. There we go. Hi.
Hi, Leanne.
Hi, how are you?
I'm good, and you?
Good, thank you. You've got a haircut. Looks great.
Thank you so much.
It's a pleasure. Thank you for joining. Did I pronounce your name correctly? I don't know. I keep messing your name up, I feel.
Sanya.
Sanya. Okay, perfect. So I'm actually just waiting for a few people to join before we actually do the talk, because everybody obviously is getting the notifications now. But yeah, it's great to have you back again. The last one we did on Facebook. So now we're doing the live on Instagram. And we're talking about weight loss. And I think, the weight loss subject affects most women,
Yes.
especially when it comes to, we're talking PCOS again. Our last talk was about the acne. It's one of the effects or symptoms of PCOS, if you want to put it
Yeah.
that way. And then weight loss, the weight gain, if I put it that way, weight gain is another problem that you deal with when you're dealing with PCOS. And again, as I mentioned the last time, is if you see me, I feel I'm a walking PCOS. I'm just like, you look at me, I walk into a doctor's surgeon, they're like, okay, PCOS. Because I have like most of the symptoms with it, and especially the weight gain around the stomach mid area.
Yes.
And and because weight gain doesn't only affect, it's not only about the fact that it affects your fertility, your infertility. It also affects your self-esteem, the way you look at yourself and the way you feel about yourself. And that is important. So you're already dealing with infertility. Now you've got to deal with the what weight, the extra weight brings with it, and how it affects you. And somebody just mentioned now, how about irregular periods? Exactly. You have all those things that goes with the PCOS as well, irregular periods. So we've got a few on now, and I'm just gonna, everyone will probably start joining soon. But I've spoken enough now because I can talk a lot. Sorry, so sorry. But I'm going to hand over to you and Sanya, and you are from M&I Lifestyle. And yeah, you're going to speak to us about Antagolin,
Yes.
and the benefits of it, and especially when it comes to PCOS and the insulin resistance and the weight, especially the weight.
Yeah,
Tell
and
us about it, please.
thank you for the opportunity. Yeah, Leanne, as you know, at MNI, our main focus is the metabolic syndrome. And we believe in targeting the underlying cause of lifestyle-related conditions that is associated with the metabolic syndrome, and we don't focus just on the symptoms. So today I want to focus on the condition insulin resistance. It's a primary mediator of common metabolic and reproductive disorders like the metabolic syndrome and PCOS. And there are several causes of insulin resistance, like age, stress, inactivity, and menopause. But the single biggest and most common cause of insulin resistance is visceral obesity. And the link between excess weight and insulin resistance is the inflammatory effect they have, which essentially causes a cascade of disruptions throughout the body. So as we know, insulin resistance is a progressive disease, and this means it increases in severity over time, and with that, the effect it has on your body. So insulin resistance not only increases your risk of diabetes and heart disease, but also liver and kidney disease and also certain cancers. Insulin resistance also causes hormonal imbalances that leads to fertility problems and skin conditions. But what you can count on is if insulin resistance is not identified and managed effectively, it will lead to developing type 2 diabetes. So it's clear that insulin resistance must be fought early, and therefore it's important for us to react to early signs. And excess weight is a symptom and a contributing factor of insulin resistance. So maybe you are gaining a few kilograms a year or struggling to lose weight. And today I want to focus your attention on insulin resistance as the underlying cause of your weight problems. So the hormone insulin largely controls your metabolism and not your thyroid gland, as many people mistakenly believe. And insulin plays an intricate role in the body's ability to store fat. Various studies have demonstrated that insulin resistance puts your body in an excessive fat storage state, increasing the fat storage and creation of new fat, and making it harder for the body to use this fat for energy. Now, with insulin resistance, your fat cells stop releasing fat, leaving you virtually incapable of shedding those unwanted kilos. And to make it worse, even if you put in a lot of effort with a very strict program and you manage to lose weight, you will gain it again and even more if you don't target the underlying cause of the problem. So sorry, there goes my phone. Sorry. So yes, weight loss is a very important issue in South Africa, where more than half of the population is medically overweight. And being overweight not only affects our daily health, energy, and fitness levels, but overweight men have a 32 times or greater chance, and women a 17 times greater chance of meeting the criteria of the metabolic syndrome. Obesity leads to serious health issues like cardiovascular disease, type 2 diabetes, systemic inflammation, and also some cancers. So maybe at this point you ask yourself, but how do you know if you are insulin resistant or insulin resistant? And according to the World Health Organization, women with a waist circumference of more than 80 centimeters, and for men it's more than 94 centimeters, are possibly insulin resistant. And we at M&I want to emphasize centimeters and not necessarily your weight on the scale. So every 1 centimeter excess increases your risk of developing type 2 diabetes. So by losing just 1 centimeter at a time, you can reduce that risk. You might also feel that you are always hungry, always tired, battling with sweet cravings, and you find it hard to lose weight, especially excess weight on your waist. So it's common. People find it hard to lose weight despite eating less and sometimes exercising regularly. But to lose weight successfully, the underlying cause of weight gain must be addressed. And in most cases, it is insulin resistance. So the solution is then to combat insulin resistance and optimize metabolism. This first will prevent, it stabilizes your blood glucose, and then you start losing weight. So, yes, insulin resistance is a complex medical condition, and you need a well-researched product that is scientifically supported. And M&I has been involved in several studies in South Africa and America, where we have successfully developed a natural product to combat insulin resistance and to help you lose weight successfully. And M&I also acquired a patent for this solution. Now, Antagolin is specifically designed to optimize blood sugar metabolism, combat insulin resistance, and the associated weight problems. Leanne, I would like to share some of the study results with you. And I'm going to with weight loss results, as I know this is what people are most interested in.
Yes.
I'm going.
But sorry,
Yes,
can I just stop you for sorry for 1 second? I
yes.
just want to maybe the reason why I want to explain to women why it is that we're talking about weight loss, and why it's important. So you might be thinking, okay, but why are you talking about weight loss and we talking about infertility? And if I recall going to a doctor before we did any sort of treatment, the doctor always used to tell me, even if you lose 5 kilos, just 5 kilos, it's going to increase your chance of conceiving. So it's, you can be overweight when you're dealing with PCOS and you're overweight and you've got, it's the insulin resistance. It's going to hinder, if I have to put it that way, your chance of conceiving or having a good, of ovulating, especially in that type of thing. So this is why this topic is very important. And so, yeah, if you're really thinking of going the route of doing IVF, IUI, anything of that sort, even if you're overweight and you just lose 5 kilos, that alone increases your chances of conceiving dramatically. So please, Sonia, sorry to break your word there,
Oh,
but I think I needed to say that, get it out there.
okay. Yes, yes, that's fine. And as I said, we focus on the underlying condition of different symptoms. So insulin resistance not only causes hormonal imbalances that leads to skin conditions and fertility problems, but it also causes weight problems. Yeah, so today we're focusing on the weight aspect, or a symptom of PCOS that I think many women experience. Okay.
Yes, yes.
I share some of the study results of Antagolin with you.
Please,
Okay,
please.
um, so I'm referring to a 26-week study. Um, um, in this study, one group only used Antagolin and the other group only followed an eating plan. And participants who used Antagolin showed an average weight loss of 0.6 kilograms per week. And participants who only followed the eating plan lost an average of 0.3 kilograms per week. We
Oh,
did a further study on Antagolin in combination with the Cape meal plan. And this study shows an average weight loss of 0.9 kilograms per week. I would also like to mention that the participants were monitored for a further 18 weeks following the study. And the weight loss results was not only maintained, but further weight loss occurred, as well as an increase in muscle mass and metabolic rate. So it's great results in terms of weight loss. But remember, we rather want to focus on centimeters than weight on the scale. And during this 26-week study, participants showed an average decrease in waist circumference of 16.26 centimeters and lost a further 5.8 centimeters in the 18-week observation period. And
wow.
remember, again, with every 1 centimeter that you lose, it lowers your risk of developing type 2 diabetes. And
Oh,
this then brings me to the general health benefits. So study participants who used Antagolin not only decreased their risk of cardiovascular disease and developing diabetes, but also their use of everyday over-the-counter medications. They've reduced their use, or it's even been eliminated. So it's
yeah.
great in health terms. It is important to understand that combating insulin resistance, or by combating insulin resistance, you can prevent the development of serious illnesses. And the good news is that insulin resistance responds very well to treatment with Antagonin. It's a safe, credit-worthy product that has been well researched. So if we look at the Antagon formulation, it contains the unique Insul X2 blend of scientific natural ingredients, and each of these ingredients was carefully selected based on the scientific proven effects in the disease process. Leanne, by using a combination of ingredients, Antagolin targets multiple pathways responsible for metabolic regulation, and these include the reduction of carbohydrate, digestion, and absorption, optimizing certain biochemical pathways that regulate blood sugar levels and body fat accumulation, as well as optimizing the hormone insulin. Now, the use of a blend of ingredients that work synergistically together, it provides improved patient outcome, but at the same time reduces the incidence and the severity of side effects. So it is very important to remember that every person's reaction on treatment is different, but it comes down to your level of insulin resistance or the severity of your PCOS. The first thing that will happen is your body will become less insulin resistant, and that will improve over time. And then Antagonin optimizes glucose metabolism and how your body uses and stores energy, and then you start losing weight. M&I has a holistic approach to healthcare, and we know that best results are achieved when a variety of strategies are implemented simultaneously, and diet and exercise have a key role in your health, your well-being, your weight loss strategy. The Cape Meal Plan, it's been scientifically designed to maximize your weight loss results by optimizing glucose metabolism and regulating insulin levels. CAPE is an acronym for carbohydrate adjusted, protein enriched, and this means that the meal plan promotes the intake of healthy protein options. It reduces the intake of complex carbohydrates, and it eliminates the intake of refined carbohydrates. All while at the same time it still offers a sustainable, balanced diet, and the whole family can follow the diet. For your convenience, we also have weekly meal plans available. You can download it from the website. The Cape Meal Plan is also available on the website. And then exercise and regular activity also play a major role in maintaining and improving your health and well-being. To get you started, we have also designed a number of focused exercise plans. It's suitable for beginners and those on a tight schedule. You can do it in the comfort of your own home. So the M&I recommendation is a combination strategy of Antagolin, the Cape Meal Plan, and an exercise program. The dosage and directions for Antagolin is 1 to 2 tablets per meals. And it's important to know that Antagolin can be taken from the age of 12 years. Weight problems amongst teenagers can often be an early symptom of PCOS. And it's important, early intervention is so important to prevent serious future health issues. And Antagolin is a safe, non-habit forming, effective product that addresses the cause of the problem.
Okay, that's great. Tell me, how long would you take it for? What would you recommend? Do you take it for 3 months? Would you say continue taking it, or?
Okay. So if you suffer from PCOS, we know that we manage the symptoms. So you can Antagonin continuously. If you want to use Antagonin mainly to lose weight, you can use it until you've reached your target weight or your goal weight, and then you can go on a maintenance dosage, or use it as damage control when you gain that few kilos again and you want to maintain your weight. So it all depends. Like I've said, it depends on the level of your insulin resistance or the severity of your. But like we said, from the study results, you can look at, if you follow you use Antagolin with the Cape Meal Plan, you can look at 0.9 kilograms per week.
Yeah, wow. That is great. And one last question is, can you take it in conjunction with anything else? Because I know with M&I, all your products are it's like holistic, and you normally can, so you can take it?
Yes, you can take Antagolin with any other weight loss product or program, or you can take Antagolin in combination with Ovibans, all for improved patient outcome. Yes.
Okay, that's great. Thank you very much for joining us. So ladies, there you go, Antagolin. It is available at any pharmacies, any leading pharmacies, as well as on our website. So our website, fertilityproducts.co.za, or you go to fertilitysolutions.co.za. You can purchase directly from us. And then, so thank you very much. Your talks are always I like the fact the M&I products is the fact that it's holistic. I mean, someone at a young age can take it. You can take it in conjunction with anything that you're already doing. And the fact that you guys focus on PCOS and the symptoms of, it's like you have, I know you've got the skin bonds as well, you've got the OB bonds. So you guys are actually focusing directly on PCOS and all of its symptoms that comes with it in conjunction to help, when it comes to infertility. So thank you very much for taking your time and the great products that you guys have.
Just want to remind the ladies listening that we have a panel of experts available for individual support. So if you have any questions, you can please contact us via email at expert@mnilifestyle.co.za.
Oh, that's great. I do see some of the questions here. Guys, I'm seeing someone saying about the IVF. We are actually doing a talk on Friday on the COVID vaccine and stuff. So you guys can log on there. But with regards to any questions regarding the products, and weight loss and that type of thing and PCOS, you can contact MNI directly. You can go to their website or you can email them expert@mnilifestyle.co.za.
Yes.
Okay, got that. Thank you again very much. And I know we'll be seeing you in a few months' time or so.
Thanks.
Have another chat.
Have a lovely
Thank you so much. Have a lovely evening. Bye.
Bye.